Medical things they don't tell you. If there are people in your family that have had a brain bleed, it could be a genetic issue that is causing it. Specifically, I'm talking about a subarachnoid hemorrhage and brain aneurysms. The current guidelines say that if you have two first-degree relatives that have had a brain bleed or have been diagnosed with a brain aneurysm, you might be considered a candidate for screening. So a lot of people don't realize that 1 out of 50 people have a brain aneurysm that's undiagnosed. Like 2% of the population has a brain aneurysm, and it's actually pretty common. And so there's a certain group of people that are considered to be high risk for developing a brain aneurysm. So if you're one of these people, you should be getting a screening. Aside from the relatives, if somebody were to have something like a connective tissue disorder like Ehlers-Danlos syndrome, if somebody were to have something like autosomal dominant polycystic kidney disease, if somebody were to have something like a coarctation of the aorta, these are all things that could potentially place a person at risk for developing a brain aneurysm. And this is such an important thing for you guys to know, because brain aneurysms, if they rupture, could be fatal. And there's so much that we can do as neurosurgeons to prevent them from rupturing. That's why it's so important to know that if anybody in your family has